Good afternoon and welcome to the CDP webinar, Hurricane Michael, How to Respond. Hi everybody, this is Bob Ottenhoff and I'm the President and CEO of the Center for Disaster Philanthropy. This webinar is provided with generous funding from the UPS Foundation and is co-sponsored by our friends at the Council on Foundations, Environmental Grant Makers Association, Florida Philanthropic Network, the Funders Network for Smart Growth and Livable Communities, Philanthropy New York, and the Southeastern Council of Foundations. A couple of reminders before we get started. This webinar is being recorded and will be made available on the CDP website. You can submit questions at any time using the Q&A box on the bottom of the screen, and we'll do our best to answer your questions. If you're on Twitter, please use hashtag CDP4Recovery to share the discussion. Hurricane Michael blew up quickly and tore through the U.S. at great speeds, leaving devastation in its wake. Some interesting statistics about the storm from CNN that show just how big and unusual this hurricane was. Michael was the first Category 4 storm on record to make landfall in the Florida Panhandle. It was also the first major hurricane, Category 3 or above, to strike the Florida Panhandle since Hurricane Dennis in 2005, and with winds at 155 miles per hour at landfall, it was the strongest storm to make landfall in the continental United States since Hurricane Andrew in 1992. After Michael was downgraded Wednesday afternoon, it became the first Category 3 hurricane to hit Georgia since 1898. The forecast cone for Michael stretched from Florida all the way north to Maryland. This meant before Michael made landfall, about 30 million people were under a hurricane watch or warning or tropical storm watch across 6 states. Michael is the 7th hurricane of the year in the Atlantic Basin. On average, the Atlantic has about 5 hurricanes by October 8. However, Florida has had more hurricanes in October than in any other month. To date, there are 18 deaths and hundreds of people still missing in the path of the storm. The majority of the missing are in small coastal towns like Mexico Beach, where Michael made landfall. It's going to take some time before the full impact of Hurricane Michael is documented and understood, but we wanted to convene this conversation today to explore how philanthropy can best respond. To update us on relief work in the affected areas and what funders can do to help, we have with us today Ken Skalitsky, who's the Emergency Management Director at Volunteer Florida. Ken has been involved in several small disaster deployments, as well as having trained several hundred volunteers and employees nationally and within the state of Florida. He was previously the voluntary agency liaison for FEMA Region 4, beginning in 1998. Sabine Perways is Executive Director of Florida Network Alliance, where she strengthens, promotes, and advocates on behalf of Florida's nonprofit sector. During her tenure, FNA released Florida's first nonprofit economic impact report and nonprofit compensation survey. Gabe Tischler is the emergency management specialist for the Florida Catholic Conference and Catholic Charities of Florida. He's responsible for coordinating emergency management, disaster preparedness, response, crisis management activities within the state and national emergency management systems. He also serves as chair of the Florida VOAD. Finally, we're joined by Sally Ray, CDP's own director of its Hurricane Harvey Recovery Fund. Sally will share her wisdom and expertise of recovery gained in the Houston area 1 year after Hurricane Harvey devastated the region. While with the Oklahoma City Community Foundation, Sally helped organizations address the significant mental health needs of children and families following the Moore tornado and other devastating storms. So welcome to our guest today, and thanks so much for taking time away from your busy work to be with us to speak today. Ken, I'd like to start with you to ask you to kind of give a brief update on the situation as it stands today?
Well, thank you very much, and it's a pleasure to be a part of this. I am the Emergency Management Director for Volunteer Florida, and we are the Emergency Support Function 15 for the state, which is volunteer and donations. So we are currently at the State Emergency Operations Center coordinating the efforts of our volunteer partners. In addition to that, we are responsible for the Florida Disaster Fund, and we have been advertising that on the media. We have been making it available on our website. We do have a text to give, and so far we've had a commitment from about $2.5 million for Hurricane Michael. In addition to that, as part of the volunteer piece, we have opened up a volunteer portal on volunteerflorida.org and have registered about 6,700 spontaneous volunteers who have indicated an interest in helping out. We've categorized those volunteers into certain skill sets. So shelter operations, warehousing, call centers, medical, and so forth. And what we're doing is we're sorting those by area and then making those offers of assistance to the counties that are impacted, that are having needs. Primarily, those individuals are assisting with points of distribution. We have a huge process for distributing water, ice, and shelf-stable meals, or MREs. We are also making tarps available. We're very concerned about the fact that it's predicted to rain tomorrow. We currently still have 16 shelters open with a large population that probably will be sheltered for a period of time based on the devastation in their homes. Overall, percentage-wise, the power is restored to most Floridians, but there are still three counties within the state that have in excess of 90% without power. And so that's very difficult at this stage to still recover. We will be working with our partners to work on immediate needs, the tarping that I mentioned, the points of distribution, the trees off houses, the putting on the tarps, the muck outs, and so forth. And so one of the areas that we're very concerned about is emotional and spiritual care, both for the residents, but also for the emergency management personnel and volunteers that are responding to this. As you can see from the picture, the devastation was amazing. Unfortunately, a lot of people did not evacuate, and we're concerned about a rise in the death toll.
Ken, about how many people do you think you're providing services to at this point?
We've set aside the capability of preparing 30,000 meals per day, and so we are in the process of establishing that hot meal service. We have distributed, I think they said, about 400,000 shelf-stable meals. We have 11 different voluntary and faith-based organizations that have made commitments to put tarps on, and we have a number of organizations that have sent in teams to evaluate their engagement when we begin the recovery process.
Can we often hear warnings for people who may want to volunteer to be a little cautious and perhaps wait, but sounds like you're actively looking for volunteers now, and you've found ways to keep them productive and also found ways to house them. Is that right? Or are you still placing restrictions on the use of volunteers?
We are still placing restrictions, and so we made the offers available throughout the state. And so many of the requests are for places that do not look like Mexico Beach, that the damage was much less. And so we were able to use them, specifically the spontaneous shelter, spontaneous volunteers in things like the call center. We've activated crisis cleanup to register individuals who have needs for assistance doing the call center. We're also operating a base of operation or a shelter for workers, and we have volunteers that are doing the registration and hospitality for that base camp. Currently, we only have one base camp open, but we have 4 more that will be open tomorrow or Wednesday to provide a place for our responders, our volunteers, our utility workers, our FEMA assistants, our state people. Simply because the hotels are occupied by individuals who've lost their home, which is the appropriate thing. And so we're making these other resources available, and my teams are assisting with that issue. The other thing is that we've had a lot of donations of non-perishable food, and so we are supporting food banks throughout the state, not just in the immediate area, and then they're packaging that donation to deliver to families.
I'd like to bring Gabe Tischler into this discussion. Gabe, you're the chair of the Florida Voluntary Organizations Active in Disasters, or VOAD, and maybe you could give us an update on what the VOAD members are doing at this stage. Gabe, we're looking for Gabe Tischler. Maybe he's on mute. Gabe, are you available?
I'm here. Can you hear me?
Okay, now we can.
I am.
Right. So, Gabe, we wanted to hear a report about the Florida VOAD organizations.
Yes, sir. So we started holding conference calls early on before the storm to assess capacity of VOAD members and partners. And then we continued those calls every 2 days to continue getting updates as to what resources are currently available and where there may be needs that are not being met. So that's our main goal right now, is to ensure that if there are any gaps out there in services, that we fill those gaps. Receive phone calls and emails daily about small communities that have not been reached by any services. So, through these phone calls, I'm able to, notify the responding VOAD members as to what the needs are in those communities. And of course, our goal is to be able to reach out to everybody, and especially the rural communities, because they tend to be some of the last ones to be able to get power on.
So, Gabe, are there gaps in service right now? And if so, what are they?
Gaps in service. We did go through a period of a few days of challenges with a supply chain of supplies coming in to feed some of the distribution sites, but I think we're past that hurdle. And that's relatively normal after a disaster. Those things just happen. Unfortunately, of course, the folks waiting for food and water are the ones that end up, suffering for it. But we're past that hurdle, and we'll be setting up a distribution center in Mexico Beach, which is, even though it looks like it's totally destroyed, there are still some homes and there are still residents there that will need services. So that's going to be our next move. And then, our plan has been all along is to set up staging areas for food drops and then truck them via smaller trucks, box trucks, or even pickup trucks into some of the more remote communities up in the national forest and throughout, the impact zone. And that plan appears to be working rather well. Outreach is ongoing daily.
So this sounds like you're still in immediate response and recovery kind of mode, right? Where you're still providing food and temporary shelter and basic needs to people? How long do you think that will need to continue?
Thank you for asking that question. And yes, we are still in that response mode. And my forecast is that we'll be in that response mode for at least 2-3 more weeks. And, housing is a big issue. And, a lot of people are living in damaged homes, and fuel is still scarce. As the power comes back on, that will not be such an issue, but right now the grocery stores are still, just getting online in some of the area to be able to sell product. And then, of course, for the poorer population, the ones that live paycheck by paycheck, it's really difficult for them to, make ends meet if they haven't been able to work for the last week. So we aim to, and I just want to make this very clear, through these distributions of various products, food, water, basic essentials, and, diapers and hygiene kits and items like that, what we aim to do is help survivors offset their living costs, not replace and reduce the amount of money that they're spending locally at businesses. But what we want to do is enable them to save some of their money so they can go buy the things that we cannot give them for free.
Thank you. Gabe, one last question, and then we're going to go on to Sabine. How many organizations are in VOED right now that are working on this, and can you give us some scope of the effort?
The effort is huge. To provide an indication, is the last Florida VOED conference call day before yesterday, we had 85 organizations call in, and that seems to continue rising every day as some of the organizations are gearing up. I do want to say that one of the things that we're looking to is the eventual closing of the Red Cross shelters, and then, of course, how we're going to address the needs of those folks that are going to be, out of those shelters. And FEMA will provide some solutions, of course, but beyond that, for the long term, we'll have to address, the long-term housing needs of this population that's been so devastated.
So this is a question for both Gabe and Ken. In my opening remarks, I talked about how this storm went on to go through southwest Georgia and then into the Carolinas. Are both of you or are either of you also working in southwest Georgia to help with issues there?
What I can tell you is that some of our partners, the Baptists, for example, have units that are doing both states from the same operation because they are relatively close areas, and certainly demographically they're very similar. As far as the state organization, Volunteer Florida will not be able to support financial efforts in Georgia or the other states.
All right. Well, maybe someone listening to this webinar might be able to text in with some additional information on Southwest Georgia, and we'll try to find out more about that. I'd like to bring in Sabine at this point, and if someone, if you're not talking right now, if you could go on mute, that would be helpful. We're hearing some background noise. Sabine, you're the executive director of Florida Nonprofit Alliance. So you probably also have a very good handle on the nonprofit sector right now. What are you seeing from your perspective?
So thank you, first of all, for holding this webinar so quickly. A lot of the counties hit, just to give a frame of reference, there's 67 counties in the state of Florida. 35 of those were declared in a state of emergency by Governor Scott last week. Of those 35, 11 are now eligible for FEMA assistance. And of those 11, a lot of those are in the bottom 10 of the 67 counties in terms of number of nonprofits and number of nonprofit assets. So that just gives you a frame of reference as to the level of infrastructure we're dealing with and capacity that we're dealing with. A lot of these counties are primarily rural, and so many of them have not necessarily utilized their emergency management teams before or have teams of 1 or 2 individuals. And so when you're trying to reach out to get a better sense of what's happening on the ground, it's been really hard to find a lead organization or a coalition that's working. As Gabe and Ken referenced, a lot of this is falling on churches. So in many of these counties, the largest entities are churches. And so Florida Baptist Church has been instrumental in identifying some of those infrastructures. And then food banks, Catholic charities, those would be the others. But a lot of these counties have just not seen a disaster of this scale, and frankly, we're not equipped to respond in a cohesive manner. So we're kind of figuring it out as we go along.
So these are also then going to be the counties where you've got high vulnerable populations.
Yes. So the other piece that Gabe mentioned, which is critical to remember, is a lot of these counties, the socioeconomic capacity of the residents is paycheck to paycheck. So if their place of where they had employment does not exist any longer or is closed, they have no means of providing for themselves. And that's going to be critical. There's also a lot of distance between homes in these counties. So, and there isn't cell service or not reliable cell service. So we're still discovering who needs what as they're able to reach out to us for assistance and requesting assistance. So that's another piece to keep in mind. The fire departments and the police departments in these counties have also been really instrumental in identifying needs, holding drives. Many of them are collecting food and products from across the state because that large infrastructure does not exist.
So how, talk a little bit about what life was like on a normal day before the disaster hit in an area where there's a lack of nonprofit infrastructure. How and where were the services being provided before the disaster, and what happens now?
So there are still organizations like Early Learning Coalition, Children's Home Society. They exist. I think the bigger point is in some of the larger cities, if I use the example of Jacksonville, and after the hurricanes that we've had here, a lot of these organizations like the United Way, the city, they all came together to create a coalition. So there was an action plan in place because we'd done it essentially. And unfortunately, a lot of times you discover by going through this process, for a lot of these counties, they had not done this exercise before. So that support system, that capability did not exist. We're also talking about counties with a population ranging from 1,100 to 2,000 people. And then for Mexico Beach's case, 12,000 people. So these are not heavily populated areas. And so that's something to keep in mind as well. So the biggest piece to remember is I think we have to look at what the needs are coming in and reaching out to those churches, the fire departments, the police departments, the food banks, and the Red Cross, and see what they're requesting. Because at this time, a lot of people want to help, but we don't want to make their jobs any more difficult than it already is by providing the resources that they actually need rather than what people want to give. And so right now we've been directing folks to the Florida Disaster Fund with Volunteer Florida. A couple of community foundations across the state have also set up relief funds and are waiting to hear from the lead agencies in these 11 counties to direct those funds appropriately.
So we've also heard that this is also a significant tourist area, at least along the beaches. And so we imagine there are many small businesses and there are tourist service workers, cleaners, restaurant workers, tour companies, etc. What do you know about those populations and how are they being served by the nonprofit infrastructure?
So at this time, for a lot of these the service industry, a lot of these places no longer exist. So I think at this scale, it's a matter of taking an inventory of what still exists. And for a lot of the tourist establishments, I think it's going to be a while for the town to rebuild and attract those tourists to come back. I think a lot of the residents are still on their way back. So, you know, as Gabe was referencing, it's still a matter of going in and seeing what we have left and taking inventory. And that's going to take at least 2 weeks to a month while we're also waiting for power and reliable cell service and food and water and shelter.
All right, thank you, Sabine. Sally, I want to bring you into this. This is Sally Ray, and Sally's with the Hurricane Harvey, the CDP's Hurricane Harvey Recovery Fund. And we'll talk to you in a little while about long term, but I want to get your thoughts on short term, having been part of the Harvey experience and then also worked in Oklahoma City. What should people be thinking about in this first week of recovery, both from a service standpoint, but also from a donor standpoint?
Well, I can tell you that my first interactions post-disaster are with fellow funders and partner organizations that we historically work with to get a lay of the land, to understand what's going on, what's happening, and get a full perspective of what's going on. And also connecting with our colleagues with BOAD and FEMA and local government and state government to help identify what the needs are, to strategically begin to think about leveraging the limited philanthropic dollars that are going to be available, and to come up with some creative solutions to potentially address some of the short-term needs.
Okay, and thinking back, what would you say foundations have perhaps failed to do, or where they've perhaps put too little emphasis in that first week or two?
Well, I think they put too much emphasis on immediate response and recovery, where there's people that are really set up to do that really well. There's a lot of dollars that go toward that, but they don't consider that it is going to be a long-term recovery, and that there are creative ways to address a long-term recovery process, that maybe they need to be thoughtful of those spots that are going to be a little more difficult to fund later, and consider that a long-term recovery from a storm of this magnitude is going to take quite a bit of time.
Well, that's a good segue to the next phase of what we want to talk about, is the recovery period. And so, Ken, let's start with you. So let's assume, as Gabe was saying, we still have another week or two or more of just immediate needs, but you must be at this point already beginning to think of what happens next. So maybe you could share with our listeners what happens a week or 2 or 3 weeks from now, and what should donors be thinking about in this next stage?
Well, thank you. I do appreciate what Sally was saying about saving money for the long term and the long term recovery, and specifically. It's easy when the camera's there to raise money, but sometimes when we do that, we think we're independent and don't have to work together. And certainly one of the tenets of the VOAD movement and certainly the efforts that we encourage is that we're all going to have to work together on this so that we can take those dollars. And while they may seem big, if you just were to say a number, the need, as you can see, is going to be so much greater than that. So we have to make sure that people are thinking of ways that we can set that money aside, we can save that and take advantage of the resources that are available. We are working right now with the state and all of our partners to determine if we're going to need some transitional shelter housing for individuals who are not going to be able to immediately go home, who are currently in what we would call evacuation shelters and gymnasiums and other facilities, and trying to find something that will give them some sense of normalcy. And so we are reaching out to some of our partners and some of our new organizations to see if they can support that, so that we don't spend money that can be used for the recovery. We also are successful in using a program out of the Department of Labor called the Displaced Worker Grant. We used that significantly last year for Hurricane Irma, and that allowed voluntary agencies to hire people that were assisting in the response and recovery, and it did not cost the voluntary agency anything, and the individual actually got the market wage instead of what they would get as unemployment. And since there are so many people that are in the service industry and other small businesses that are not going to be able to go back to work right now, we can put them to work with our voluntary agencies to help with things like debris removal, to help with things like minor home repair. We're also looking at some federal programs that were successful in both Harvey, Irma in the States, and Maria in the islands, to make sure that everything's on the table to think about this. The other thing, it's amazing as you watch the pictures. I mean, we're still seeing them, all the time on TV. Mitigation works, and so there are homes that survived even a Cat 4/5, and it's because of those mitigation efforts. And so we're trying to make sure that as the organizations that are engaged in the repair and rebuilding are actually incorporating mitigation activities into that. And so we're trying to make sure that we have some incentives for those organizations to access some of the funds that the state is eligible for because of the scale of this operation.
So when we say recovery, what does that mean?
Certainly, what I used to say when I was at FEMA is that first you have the voluntary agencies, insurance, then the government, and then it goes back to the voluntary agencies. And an individual who did not have insurance was going to have to rely on their individual rainy day funds, which many of us have had to tap into in the last several years. Certainly any government assistance that's made available to them, the efforts that voluntary agencies have been successful at in getting donations of things for the recovery, building materials, appliances, furniture, those kinds of things, the actual donations that come into those organizations so that we can pay for things like HVAC and plumbing services that require contractors. And then finally, that volunteer effort. And so we're putting together a lot of effort towards that, capturing those volunteers. And so Gabe and I work very, very closely on making sure that we're capturing that, because there is value to those volunteer hours in an offset to the cost match that the state's going to have to bring forward for the expenses of Hurricane Michael. And so we want to capitalize on that as much as possible so that we don't have to put an additional burden on the people that have been impacted by raising taxes or cutting services in the future.
All right, thank you, Ken. We want to remind our listeners, if you have a question for our panelists, you can use the Q&A box at the bottom of the page. We'll try to get to your question in the time we have remaining. Sabine, what are you thinking about as you look toward the next few weeks and then months after that? What is the Florida Nonprofit Alliance going to focus on?
So we've done a couple of things. Late Friday and over the weekend, we reached out to all of our members in the Big Bend and Panhandle. And I will say for the rest of the country and the state, a lot of people don't really know what cities, which cities that include. So trying to identify them by name, by county, so people know where to search, because Panhandle and Big Bend don't necessarily clarify that. Waiting to hear back from them so that we are including them in the conversation around recovery and rebuild and not necessarily speaking out before they've had a chance to do an inventory of their program needs, their facilities, and their clients. Again, the lack of cell service and the distance in a lot of these counties does make a huge difference. And then we're hoping to work with our partners here at FPN and the Florida Chamber, as well as other entities that are really heavily present in the Tallahassee area, which is also really important.
And do you see yourselves building new organizations, or are you working on capacity building or alliances? What kind of a strategy do you use in a situation like this?
I think the key piece to remember is that all sectors are going to need to come together to answer that question. It's not just the nonprofit sector. The Florida Chamber is wiped out too. So the business community, the philanthropic community, the nonprofit sector, all are going to come to the table to figure that piece out. I don't think any one of us could do that independently. You can't rebuild towns alone. And so I think the bigger piece is, where do we go from here, and how do we get everybody together? So referencing what happened after Irma is important, but I think for a lot of us, it's going to require going to this area and speaking with the stakeholders firsthand. I don't think we could do it from the sidelines.
All right, thank you, Sabine. Gabe, how about the VOADs? What will they be thinking about in the next few weeks, and then in the next few months? And how long do they stay involved?
So just to kind of echo what Ken said, I have to say that, this is the time for us to start preparing for the long-term recovery efforts, and we're looking at that. Florida VOAD partners will continue to be involved until, the recovery is completed. It's what we do. We want to make people whole again, and of course we do that by, empowering them and once we get past this initial stage of relief, then case management will start, disaster case management. And we want to give these folks a hand up to, empower them to start looking into the future and how they're going to recover. And furthermore, to prepare for the next one.
Okay, thanks. Sally, we wanted to have you on this call today because you've been through this before, and we wanted to take advantage of some of the lessons you've been learning, particularly in Texas, where there were large swaths of rural areas where we had populations that were struggling before the disaster, who were badly hurt by Hurricane Harvey. And so I wanted to just get your thoughts a little bit about what would be your advice to people in Florida about what they should be doing this week and then next month, and what they should be thinking about for the long term.
For the long term, I think there are several things to consider. As you mentioned, consider potentially addressing those needs in those communities that aren't getting the media attention. In Harvey, Houston, and Rockport got the most media attention, but there were 41 counties that were affected, and some of those pretty significantly, and they just didn't get the resources they needed. So we focused strategically, our fund, we focused outside of Houston and Harris County. Also overestimate how long it's going to take for recovery, and you're still going to be short, I suspect. Don't give all the dollars to immediate relief and recovery, because the hardest recovery dollars to raise are those that are long-term. And those are also sometimes the most difficult problems to solve and the most expensive. Look at all sectors. As Sabine mentioned, you got to look at all sectors, not just the nonprofit sector, but everybody working together. Plus, within the nonprofit sector, consider not just direct service to survivors, but also those supply chain groups. Some of the best funding we did here, not just us, CDP, but also our fellow funders, was in that supply chain. We funded Good 360 so that they could provide supplies to those organizations working with survivors. Our partners funded Tool Bank and Mission on Wheels to help support those organizations that are working directly with survivors. And also, if you're a funder, you're looking to fund an organization, don't cut short those administrative costs. For example, we funded our long-term recovery groups outside of Houston and Harris County to help build their capacity, and that was specifically administrative costs that we funded, because volunteers can't do everything, and you do lose the volunteers eventually. We love our volunteers, but they tend to lose interest, and you don't have them at the level that you had them at the start. And sometimes, honestly, no offense to our volunteer partners, but you do occasionally get what you pay for. So if you want good quality work, you need to sometimes be prepared to pay for those administrative costs. So those are the things that I would consider long-term, and even as you're beginning to look initially at where funding dollars can be directed, those are some of the top things that I would consider.
Sally, just to follow up on one point you made, you said that the fund put money into long-term recovery programs. Can you talk a little bit about what those are and why you supported them?
I'm sorry, was that directed at Ken?
That was to Sally.
Okay.
Sally, I was asking about the long-term recovery committees. Sounds like we've lost Sally for a moment. One question.
If I may respond to that, from our perspective here in Florida, we do administer the Florida Disaster Fund, as I indicated. We have two elements to that. The first is response, and there's a mechanism under our policies to distribute grants, and we were able to give out about $2.6 million to about 83 different organizations. Our second piece is recovery, and we were able to fund or make available funding for 35 long-term recovery committees, specifically to that administrative support to maintain some stability. And that's been matched with a grant from Red Cross, which we really appreciate. And then also that money is 100% matched by the recipient. And then we've also made grants for recovery to about 125 organizations that are doing things like buying materials and bringing in contractors to assist with certain elements that the volunteers can't do, or they're expanding capacity, or bringing in advocates for individuals. We are encouraged that we did get a disaster case management grant that allowed us not to have our voluntary agency spend money on that particular element. And so we have, Volunteer Florida has 4 grantees that are providing that for Hurricane Irma. And we are long ways from having recovery completed for Hurricane Irma, and that will be complicated by Hurricane Michael. The other caution that I have is that the pictures that you see on TV are devastating. They're real, but the reality is that they're the ones that are easy to get to. And so there's going to be a lot of people, I've lived all over the country, there's going to be a lot of people who say, well, I wish I lived on the beach. They should have known better. But the reality is many of the people that we're going to be helping are not the ones that the cameras are seeing. And these are the homes that have been with families for generations, and they are off the beach and not anywhere near the water. And they've been doing menial salaries and agriculture and other kinds of things that are not getting the attention from the media, and they're going to have significant needs that we're going to have to be able to solve.
We've had a couple of questions from listeners wanting to know about South Georgia, and there is a community foundation of South Georgia located in Thomasville, Georgia. And if you'd like to learn more information about what they're doing, they're Phone number is 229-228-5088. That's the Community Foundation of South Georgia. We're also looking for more information on community foundations in northern Florida, and we'll get that to you as soon as we can. One question for the group, maybe Sabine, you can get us started on this one, but the question is, how are funders working with communities not limited to local governments during recovery and mitigation, planning to ensure community-driven solutions, particularly in those communities traditionally underserved and overburdened? So this gets into the whole issue of making sure that we have an equitable recovery. How would you answer that one, Sabine?
I think one of the key pieces to remember is we're still going into a lot of the places to figure that out. As Ken said, a lot of the times people see the larger cities and forget the smaller ones. And the smaller counties, the rural counties, are the ones with a lot of this underserved population as well. And at this time, it's more of taking the inventory to figure out who needs what and what are the most urgent needs. I don't think there is a plan of action that is being implemented. I think, again, we're still in the phase of taking stock and collectively deciding how we're going to help everybody.
Sally, I'm wondering if you've joined us again.
I'm back, and
Okay,
I'm sorry.
great.
I don't know what happened.
Okay, good. I wanted to get your take on this issue. Is how do we make sure it's both a good recovery, a solid recovery, but also an equitable recovery? Because I know you've been struggling with that issue in Texas.
Oh, yes, we struggle with that. Equitable recovery. Yeah, the thing that I mentioned earlier, I'm not sure how much you heard. Housing is a very difficult issue. It was a difficult issue prior to Harvey, and it's kind of exposed a whole lot of issues around that. And it's what we see is that the federal government and the state government tends to help those that are middle income to mainly middle class, middle income folks, and don't address the needs of those who are more vulnerable. And so I think it's important that philanthropy be able to focus on the more vulnerable population in their recovery support. And that's something we've really focused pretty strategically on here with our fund. And I think it's really important that those philanthropy dollars are the most flexible. And so that's why I think it's especially important that we help address the needs of those who are most vulnerable and who may not be seeing their needs met with the other dollars that are available.
So Sally, the other question I had asked you before we lost contact was to talk a little bit about the recovery committees, the long-range recovery committees that have been established throughout Texas, and what they're doing.
Okay, sorry that you lost me on that. Long-term recovery groups, committees, teams, they're usually formed in a community, in a county. I suspect Florida has a pretty strong long-term recovery committee or group network from the number of events that they've had. But they form specifically, they're collaborative groups that form with nonprofit organizations, government entities, churches, community leaders, to help strategize and plan for the long-term recovery process. And we funded those here to help build their capacity so that the counties that were affected would have a strong, efficient, and effective recovery that met the needs in the best possible way for the communities that they serve.
Gabe, how are you getting connected to the long-term recovery committees?
Absolutely. That's one of the things that Florida BOAD does is, we work directly with some of the communities and have for, many years to help local communities organize long-term recovery committees, organizations, whatever they may choose to be called, and kind of mentor them through the process of what this new animal looks like called long-term recovery. And, I often say that, response is easy. Long-term recovery is very difficult, much like what Ken mentioned earlier. The cameras are on now. And, but once all the, cameras are shut off or another disaster happens, we'll be forgotten, and so will long-term recovery 2 years from now. So that's an important piece of what we do, and including, supporting disaster case management. And our members are, of course, provide those services as well. Did I answer your question?
Yeah, that helps very much. Thank you. Ken, this is a question from a listener, and I'll direct it to you. This writer represents a nonprofit from out of state, and it looks like a group of small organizations. They want to know if they can do work in the state, and if so, are there any opportunities for recovering time and travel expenses? Do you encourage out-of-state nonprofits, I guess, is the issue?
So we have a number of national partners that don't have a presence in the state under blue sky that are very engaged. And we also take on many of the small organizations that have developed in other places for small events and have been successful. And so there is a number of ways that we will be working together, potentially in our recovery grants, which is a competitive grant process. Organizations that are going to be doing things in Florida might be eligible. And then also FEMA has been very, very supportive of providing what we call invitational travel to support organizations to bring in staff and pay for their travel expenses. It does not cover income, but it does cover the cost of travel and then lodging. And so we're going to work with FEMA on that particular thing. We've addressed it with the federal coordinating officer already.
Okay, good. So someone could contact you if they wanted to pursue that.
That's correct.
Yep. We heard from Bob McFalls. He's the president of the Florida Philanthropic Network, and he wanted to share that there are two community foundations in northern Florida. One is called the Community Foundation of North Florida, and the other is the Community Foundation of Northwest Florida, and they cover most of the severely impacted areas that we've been talking about. So that's Community Foundation of North Florida and the Community Foundation of Northwest Florida. We've got just a few minutes remaining, and we want to, again, urge people, if they do have a question, to let us know. This is one that just came in, and this is directed, I think, to either Ken or Gabe. What services are being provided to kids who may not be able to go to school right now?
Ken, you want to do that one? Or
Sure. So we are working very closely with the Department of Education to get as many schools back on track as possible. In the absence of that, we do have some programs that we are instituting at the shelters for the children that are living there. We've engaged with our partners with the Southern Baptists, who have a disaster child care, Church of the Brethren, and Save the Children, who all have programs. We've also reached out to Disney and asked them to provide assistance with some activity donations for those individuals in the shelter. The schools, as a facility, are working closely with FEMA to bring in additional resources, such as temporary classrooms that can be put in very quickly so we can get children back in school. But there are a number of schools that were able to reopen today, and there is a number of additional schools that will be opening up on Wednesday.
I want to give each of you an opportunity to give a closing remark, and what I'm going to ask you to focus on is, what should donors be thinking about now in the next weeks and months to come? And what would you, tell us about how they should be thinking about their dollars at this point. And Sabine, let's start with you.
I would say unrestricted funds are the most generous gift at this point. A lot of the institutions themselves are trying to come back to capacity. And so at this stage, to add an additional burden of reporting just wouldn't be feasible for them. So I would say unrestricted dollars and looking at non-traditional organizations for support. So, we mentioned churches and police departments and fire departments. And so looking outside of the usual 501c3 organizations that foundations tend to support and really looking at the needs of each county as opposed to the traditional players that are usually present in this conversation.
Thank you, Sabine. Ken, what are your thoughts?
Well, I think the big thing is that it's very easy to think as soon as Home Depot has the garden equipment on special and we have ads for eating out at the local restaurant that the disaster has gone on. Certainly, if you fly into any airport in Florida right now, you will still see plastic sheeting on houses because of Hurricane Irma. And this has been a year after that specific event. And so we are going to have needs beyond what we can raise at this particular time. The other thing is it's very easy for there to be donor fatigue because, as you mentioned at the beginning, this is the 7th hurricane in this hurricane season. We had the most incredible season last year. They're predicting on the Weather Channel that it's going to be the new norm, and it's just real easy to just say, "Oh, didn't I just give?" So that's my concern.
Thank you, Gabe Tischler.
Yes, sir. I think it's important to keep a couple things in mind. As we transition into long-term recovery, many times those small communities are often neglected. But even beyond that, one of the things that we focus on when we do disaster case management for long-term recovery is not only the most vulnerable populations, the low income, the obvious ones, but we really want to focus on the lower middle class and even the middle class, because by assisting them after a disaster, we can actually keep them out of the welfare roll. We can keep them out of becoming chronically poor. It doesn't take much for, any family just to fall into that social welfare services trap that they may never be able to get out of after a disaster. So I think, for the long term, getting ready for the long recovery that this is going to take, and the rebuilding of communities is just crucial to bringing communities back online, and of course for folks to be able to live a normal life again.
Thank you. Sally Ray, given your experiences in Texas over the last year, what advice would you give us today?
Well, I would suggest that they don't be afraid of being creative or doing things a little differently. Partnering with organizations you haven't partnered with and considering different ways of funding and a different direction than what you typically would fund in. For instance, they mentioned that these are some tourist communities. So supporting small businesses and the local chamber to build those businesses back up can have an impact on the entire community and get people coming back, which will get dollars flowing. So just some creative thinking about how best to support long-term recovery and honestly community resilience and building those communities up so they're more likely to survive the next one.
Thank you all, panel. A couple of closing remarks. After Hurricane Florence, we here at CDP launched an Atlantic Hurricane Fund. It was clear that Florence may have been the first, but was not going to be the last. And so this fund is also now supporting Hurricane Michael. And it will be devoted to medium and long-term needs of vulnerable populations. So if you'd like to learn more about this fund, you can see the link there, disasterphilanthropy.org, or you can give us a call at CDP if you want to learn more about it. To those of you who may be planning disaster response funding, CDP has many additional resources and information in our disaster playbook. You can find this on our website, and it's full of tips and best practices about what donors can be doing during and then after disasters. Our friends at the Foundation Center have been tracking private institutional response to Florence. This is as of Sunday. So far, a little over $17 million has been donated to date. And you can learn more about it. You can see on the website there. Most of this was from company-sponsored foundations and a little bit from public charities. So we do want to thank very much our panelists today, Ken, Sabine, Gabe, and Sally, for taking the time to share their insights. Special thanks again to the UPS Foundation for hosting this webinar, and to our co-sponsors, the Council on Foundations, the Environmental Grantmakers Association, Florida Philanthropic Networks, the Funders Network for Smart Growth and Livable Communities, Philanthropy New York, and the Southeastern Council of Foundations. Thanks to all of you for joining in today. Thanks to Ruja and Tanya for their work in producing this webinar. And we want to thank you and have a great afternoon.